The Meghalaya government has decided to set up an independent agency to be known as the Meghalaya Medical Drugs and Services Limited to address the perennial problem of non-availability of essential drugs, medicines in hospitals and health centers across the state. Talking to reporters, Health Department Secretary Ram Kumar said that the independent agency will be responsible for procurement of essential drugs and medical equipment for the health centers in Meghalaya and also streamline a system for indent, supply, maintenance and disposal of drugs and medicines. Kumar further said that the agency would also improve the management of drug procurement and supply with special emphasis on logistics along with ensuring quality of drugs.
Matter of drug supply, there are basically three major agendas and one more minor agenda. One is that for streamlining of drugs and diagnostic supply. The second part is taking care of the equipments. Many equipments are there in the facilities, and we have to see training, cost, and etc., maintenance, all of this, these things. And the third is that creating this whole online system of doing the entire, from the point of indent to the delivery, everything to be online. That essential drug list has been notified for sub-center. These are the drugs they have to have. These are the PHC. These are the drugs they're supposed to have. CHC. These are the drugs supposed to have. Predominant of them are generic drugs. So there will be a proper, tender process which has to be done, and these drugs has to be identified, and so that the supplies can come, and there is to be a quality system to ensure the quality and safety of these drugs.
The Meghalaya government